Not everyone is aware of what is really going on inside the laboratory. Others believe that we are just sitting, extracting blood, then processed through the microscope, and that's it. To be a laboratory practitioner is not an easy job. It requires a highly competent professional since we are mainly dealing with patients' lives. Though we may spend less time with the patient than the doctors and the nurses, we also have our own day-to-day battle while dealing with biological specimens in order to aid in patients' diagnosis, treatment, and prevention of diseases. This is a video of a good quality practice of our 6 laboratory units, starting with sample collection, transport, processing, and ending with report verification and releasing.
السلام عليكم.
عليكم السلام. إيش اسمك؟
علي حسن مبارك الزهراني.
تفضل.
ايش اسمك؟
علي الزهراني.
انت صايم؟
ايوه.
طيب خليك مستريح عشان اسحب لك عين الدم.
To ensure patient safety at all times, it is our policy to identify patient correctly. The phlebotomy also verifies the patient's condition, applies proper blood extraction techniques with the correct order of tubes, gently inverts the tube to avoid hemolysis and clotting. Labeling is done right after extraction and before leaving the patient's site. All specimens are placed in a biohazard bag, to be placed in a tray arranged in an upright position, and to be transported to the main lab immediately. In chemistry and hormone unit, samples are received by a technologist to inspect for its identity, the tests being requested, and to take note of the priority whether it is routine or stat. After centrifugation, samples are then to be processed using a highly automated chemistry analyzer. Because chemistry unit is statistically to have a high volume of workload, the next scenario that you are about to see is frequently happens on a daily basis.
I received a sample from ER. The request is troponin.
The result of the troponin is critical value. Please rerun the sample to confirm and check if everything is correct. Okay.
The result is confirmed critical.
Okay. We need to relay to the ward as soon as possible.
Assalamualaikum. My name is Fatma from Chemistry Unit. I want to relay a critical value.
Hematology unit processes samples requested for CBC, platelet, coagulation factors, and many others. Upon receiving of the samples, the technologist inspects for the specimen condition. In case of any discrepancies observed, like clotted blood has been detected, the technologist promptly calls for sample rejection. Samples that are requested for hepatitis profile, HIV, and other immunologic tests will be carried out in serology unit. After centrifugation, samples are assayed in a well-designed automated confirmatory analyzer. Anatomic pathology unit is composed of 2 main divisions, histopathology and cytopathology. The main specimens are tissue biopsies and body fluid cytology. Before a pathologist can determine whether a tissue is normal, tumorous, or inflammatory, the The sample has to undergo several stages of preparation. The steps starts with grossing, fixing, processing the tissue, embedding, sectioning, staining, and lastly microscopy. Blood bank unit is where samples for cross-matching, blood typing, blood donation, blood component separation, and storage are being done. Like any other unit, blood bank plays a very important role because it ensures a constant supply of usable, compatible blood for use in transfusion and other medical procedure. Microbiology is where urine, stool, sputum, swab samples, and other biological specimens are being processed. Generally, samples in microbiology are planted in a growth medium that designs to allow bacteria that causes infection to grow so that the microbiologist will able to identify not only the type of the organism present, but also the type of antibiotic can be used to cure the infection. Laboratory reports are verified or reviewed by the consultant or registrar before releasing. However, in the case of afternoon and night shift, only urgent or stat reports are released and to be reviewed by the head of the unit during the morning. Laboratory reports are released in two ways. By hard copy, that for the inpatient, it will be released through the nurse or porter. For outpatient, it will be submitted to the medical record department to be kept in patient's file. On the other hand, laboratory report can be released through the hospital information system. For both in and outpatient, by just clicking the authorized icon, the report will automatically received by the requesting physician. And that ends our presentation. May this video guide us to accomplish our task in a safe and timely manner.